Good morning. 5 months ago, on March 7th, I signed an executive order directing the Department of Public Health to strengthen its partnership with Missouri Family Health Council in order to expand reproductive health services in St. Louis County. Today, I'm pleased to report that the Family Health Council has accepted the Health Department's application to join the Right Time Reproductive Health Initiative as a participating health center. This partnership will expand our family planning services beyond the current Title X program by providing additional funding and reimbursement. The exact amount will depend on how many residents are served per year. For those who may be unaware, Title X is the only federal grant program dedicated solely to providing individuals with comprehensive family planning and related preventative health services. This additional funding through the Family Health Council will allow us to provide same-day birth control methods so patients can be served at the time of their counseling and initial appointments. And it will provide orientation and training opportunities for our staff to improve our services. These are huge steps to improving care for hundreds of residents annually served by the Department of Public Health. The Right Time is a 6-year initiative based on the belief that everyone should have the opportunity to pursue the future they want, including if, when, and under what circumstances they get pregnant. The initiative aims to empower individuals to take control of their own health by improving information about and removing barriers to contraceptive services, recognizing that decisions always rest with the patient. The partnership has never been more important given the Supreme Court decision overturning Roe v. Wade. St. Louis County is committed to reducing health disparities and providing our population with services and support for improving reproductive health. The services through this partnership add services to the existing work of our health department. Our department currently promotes reproductive and sexual health through multiple initiatives at all 3 county community health centers, the County Justice Center, and the Juvenile Detention Facility. Services include care related to pregnancy and childbirth, family planning, counseling and services, sexual health services, and wellness exams. The U.S. Department of Health and Human Services has identified reducing the national rate of unintended pregnancy as a critical step to improving health. Unintended childbearing is associated with a number of adverse maternal and child health outcomes, including inadequate or delayed prenatal care, smoking and drinking during pregnancy, premature birth, poor breastfeeding, and higher rates of child maltreatment. About 1,500 patients receive these services and care annually from our health department, the majority of whom are persons of color. And many lack inadequate health insurance coverage. Public health departments are safety nets ensuring those who are uninsured or underinsured have access to healthcare services. Reproductive and sexual health services are a critical piece of the health department's mission. And this new partnership will help us provide better care for more of our residents. My administration is committed to doing all we can to protect the health of our residents, including those most at risk for adverse health outcomes due to lack of access to reproductive health services. Before I close, I'd like to remind residents of flood resources that are available. FEMA opened a disaster recovery center this week at the Hazelwood Civic Center. It's open from 8 in the morning to 7 at night, today and Friday. FEMA representatives will provide one-on-one assistance to people affected by flooding that occurred between July 25th and July 28th. There's also a recovery center in St. Louis City at Rankin Technical College, 1313 North Newstead Avenue, and it's open 7 days a week, 8 in the morning till 7 at night, until further notice. Before visiting any recovery center, please apply with FEMA online at disasterassistance.gov or call 800-621-3362. Also, the Small Business Administration and the Missouri Small Business Development Center have opened a recovery center to provide a wide range of services to businesses impacted by the severe storms and flooding. The Small Business Recovery Center is open at the Urban League office at 1408 Kings Highway Boulevard. The hours are Monday through Friday, 9 a.m. to 6 at night. And the location is in St. Louis City, but the services are available to any St. Louis County, St. Charles County business. No appointment is necessary. All these services are provided free of charge. I'd like to remind everyone that state and regional health officials last week announced a monkeypox vaccine distribution plan for St. Louis area that expands eligibility for vaccination based on recent increase in transmission of the virus in our region. The state designated the St. Louis County Department of Public Health as the St. Louis region's vaccine hub for St. Louis County, St. Louis City, Jefferson County, and St. Charles counties. The State Department of Health and Senior Services has distributed 1,900 vials of monkeypox vaccine to the St. Louis County Department of Health for use within our region and for distribution to other areas of the state that may experience an increase in need for vaccine availability. Based on our very recent CDC guidance, several people may be vaccinated with each vial. And Missouri public health officials are incorporating this guidance into our vaccination plans. Under the current plan, the vaccines are reserved to protect those who have had close contact with someone who has had monkeypox, or for those who might meet the CDC criteria for being at high risk for contracting the disease. A supply of monkeypox vaccine is limited nationwide as well as in Missouri, and area health experts expect the demand to outweigh the supply, at least initially. The Department of Public Health has also requested additional doses and expects more of those vaccine doses to be coming in the next few days, depending on nationwide availability. More information on monkeypox can be found on the county's website at the Department of Public Health's webpage. And finally, I'd like to note that August is National Immunization Awareness Month, and it comes as many area students are headed back to school. The Department of Public Health encourages you to make sure your children are up to date on immunizations and vaccines, including the COVID-19 vaccine to protect against serious illnesses. Last week, the Health Department had a vaccine clinic, and they'll hold another one from 9 in the morning to 1 in the afternoon on September 10th at the John C. Murphy Health Center. There's no cost associated with getting these vaccines. That's all I have, and I'd be glad to answer any questions.
You guys anything? We have one from Public Radio, Dr. Page, about how will the November elections for county council seats impact the cohesiveness between the county executive's office and the legislative branch?
So the question is about the November elections and cohesiveness between the county council and my administration. I think what you'll see first of all is that after the primary elections a couple of weeks ago, the cohesiveness on the county council will continue to improve as it does after most elections. I expect the same in November, not only here in St. Louis County, but across the state and across our country. After elections, folks settle down and agree that they have to work together and take care of the people's business. I expect that the cohesiveness within the county council will improve, and certainly that will lead to a better working relationship with my administration, and I look forward to that.